I'm Raoul, an integrative medical doctor practicing participatory medicine. Can you imagine a medical or a therapeutic consultation with a doctor or a therapist or counselor or a healing practitioner where the health practitioner is so completely present with no internal distractions like his indifference or his tiredness or his prejudices or his anxieties, and gives this projection of self-awareness and self-empowerment to the patient or the client, enabling her to feel safe, feel trusting, feel open to disclosing her inner life and her inner story. And that the practitioner is able to pass on certain skills to her, to start looking at herself objectively, so that she can start to recognize her own blocks, her own internal restrictions that are actually the seeds for all the predispositions and the chronic illnesses that we see today. Where she also discovers through the skill that she learns a way of finding her own hidden resources to begin to manage and to transform her own inner problems. And rising to this level of awareness between practitioner and patient and client, a heightened awareness emerges, one where there is a conscious partnership for creating a new awareness for the client, for the patient, enhancing the diagnosis and the therapy infinitely, and improving the actual health outcomes. It's done in every counseling session that I have, where one passes that skill on to one's patients and clients, who then begin their process of inner transformation. So it's actually very possible to actually train other practitioners in this form of medicine, and that's what I have begun to do, start training practitioners in this emerging form of integrative medicine, which I'm choosing to call participatory medicine. Participatory in the sense that patient, practitioner, and the therapeutic relationship itself is actively and dynamically engaged in a participatory process which significantly enhances the therapeutic outcomes. And this is now scientifically validated. When a practitioner is positive and enthusiastic and open towards his patient, the science shows us that the outcomes are better. And when the patient himself become active partners in their own healing, and they are positively engaged, the outcomes are better. This threefold interaction within the practitioner himself or herself, within the patient or the client, and within the partnership, the therapeutic partnership. But to give you an idea of how it works, I want to demonstrate the process. And this work is always participatory in the sense of interactive. If I had you in a seminar process, we would be doing work together, but because it's limited to this time, I'm going to do what I do in my training, and that's demonstrate myself. So I'm going to take 2 chairs, and we are imagining a consultation. where I have the honor of receiving a new patient who comes into the room, and I see a young woman, probably not much older than 30, in a very emaciated state, hunched over and obviously in pain. She comes and sits in the chair. And she tells me she has breast cancer and it's at an advanced stage, and she's been through a whole lot of other medication, chemo and stuff, and they've given her not much hope, but they're still going on with the treatment. And I listen to this. And I watch what's going on inside of myself. And there's a moment of, oh my God, I've seen this before. I know many patients who went through this journey, and most of them didn't survive. And I'm feeling, and I'm watching myself, and noticing what's going on inside of myself. And I feel immediately a sensation of restriction and anxiety. And will I be able to help this patient? And I don't do this in the consultation, obviously, but through the long training we've had, it's there, I'm aware of it. And you can imagine, this is not a position of empowerment. This is not a position where I can give her the best that I know. And so I have to do something about it. So inwardly I step out. I have to step out of it. I have to see myself in that state of tightness and anxiety. And I see myself, and this has been my process, of course. I know there's an anxious person there. I know that one. It's a young boy. He always has been in this state of anxiety when something comes. He's obviously not the one to be in the doctor's seat. I have to tell him, it's okay, you don't have to worry. I'm here. Let's take you out. And let the empowered physician take the chair. And I have to make sure that I'm present. And now I sit in a totally different state, and I open and welcome the patient to tell me her story. And I watch myself all the time, that I don't slip into prejudices or doubts or anything which would cloud my perceptions and my experience of this person. I'm able, therefore, to listen and be completely present for her. And she tells the story, and I listen, and ultimately I have to ask her, so what is it that you want to do with this? What is your wish? And she ponders it for a moment, and eventually it comes out. I wish to find the way forward to give myself those extra years. I have children and I want to be with them. I wish to contain this illness and be actively involved in the process. And I look at that, I see her, and there's immediately a choice that she's made. She's in her power there. Very different to the way she entered the room. And I ask her to actually step out of that position and have a look. We're both observing her in her power. Ask her, how does she look? How does she see it? And she says, that's a different person. That one I like. I say, fine, this is the partner that I need. I ask her to, before we proceed, to actually show me the one that has been so disabled, so weakened. And she goes there automatically, back into this prison, this dark place, the despair. And she will do something that is very unique to her experience, based on her awareness. And whatever it is, we let her out of that shake it off, make sure that she's not still carrying it. This I'm doing very quickly. This can be a process, but it can happen in a consultation. It's not as if we need a whole long process for this. But she looks and she sees the other side, and she knows that something has to be done for this one. So we are in a position where she is starting to learn skills to recognize her own disabilities, find her own power, and then start to do something about it, which I'm not going to go into here. But infinite possibilities emerge. And of course, the two of us standing like wise, intuitive people seeing the story of her life unfolding, we're in a very powerful position to guide the process. I just being a supporter, she as the active choice maker. And we see the therapeutic partnership emerging. In every therapeutic encounter, in fact in any partnership, there are these three spheres of activity. There's the I, there's the you, and there's the we. And so the construct of the training is about, well, 3 modules. First one is about the I, getting to know the self, getting to understand the limitations, the fixed ideas that we have, the conditioning that has created this finite, closed, limited personality. All the aspects of the personality that are self-created mostly for our own survival as children, as young people. But that can be opened and expanded if we know what we have. And so it's about finding also the greatness, the resources. And the second module is about the partner. Do you know the hundreds of partners that we have within ourselves? And we are always in relation to that. So I'm the father, but I know I'm the father, and I can relate to my fatherhood. Or I'm a child, and I'm in relation to that one. We can always find that connection, and that is what the awareness is about. To discover that consciousness, so that you know who you are. It doesn't mean you're always outside. You can choose to go in, and we play these parts throughout our lives, but we are in partnership with the you in us. Of course, the you in the partners outside, in the patients and the clients. And we learn in the second module to understand the you, live into the you, and develop an empathy and a compassion for the you. And this process evolves to the third module, which is about the we, the therapeutic relationship, and the intuitive power that comes out of that level of awareness. And so that has become for me a huge, motivation to welcome people into this training so that we can establish networks in different parts of the world. I believe that kind of entrainment that emerges would really make a significant impact on global awareness. And so the training is there to develop a new and what I believe revolutionary approach to medicine, to therapy, to counseling, to all healing activities, wherever, social, environmental. For me, it's not only confined to the human, that's my particular work, but I believe this conscious awareness of partnerships is something that is so global and so wide and diverse that it can be used in this approach can be made use of in any healing environment. So this is what it is about. It's about tapping into inner skills that can explore that world, that inner world of the unconscious, that can learn to manage and deal with it through finding the power and the resources that are also there, and then to use that, first of all for oneself, but then for one's fellow human being and for the world we live in order that we can change the consciousness of life on this planet. I think that is what I would like to say today. Thank you so much for listening.